Hello everybody, my name is Larry. This is my channel on living with stage 4 metastatic prostate cancer. It's January 26th, a Friday in the year 2024. And I'll just bring you up to speed a little bit. The last video I told you about how I had been to my primary care physician, Dr. Fadi, and complained to him about shortness of breath going upstairs. So he recommended I see a cardiologist. I had 3 tests. And in one of the tests, they found, the X-ray found that I had an opacity in my lower right lung. So my cardiologist, the PA, Elizabeth Scott, talked to my radiation oncologist, Dr. Alite, Alite, and he set me up to have a CAT scan on January 22nd, which I took, and I do have the results from that. And I spoke to Dr. Alite on the 24th, 2 days ago, Wednesday, and here's the results of the test. I'll just read it to you first. It says there is atelectasis, which is a partially collapsed lung, peripheral mucus plugging, and tree and bud opacity centered in the anterior basal right lower lobe. A definite obstructing endobronchial mass is not seen to account for this. And then I've got a 3 millimeter left upper lobe nodule, which remains unchanged since the last study I had done in 2021. So, after talking to Dr. Lee, what all of that medical jargon means is I have probably, the good news is I don't have a cancerous tumor there. It does not look like a cancerous tumor. So yay, that's terrific. I was worried about that naturally because I've already had a tumor in my right lung, a cancerous tumor, and which was treated with radiation. So I don't have another tumor. It doesn't look like. What it looks like I have is I have had either a viral or a bacterial infection in my right lung, and this is the result of that is I have a very small section of my lung. It shouldn't be causing my shortness of breath, but it's a little collapsed area in my lung, and that's what that opacity was that the X-ray was looking at. So I had a contrast, a CAT scan with contrast, and that leads my doctors to believe that it's the result of a viral or bacterial infection. So I'm relieved about that. I mean, I've tried not to worry about it, but it's almost impossible. I think everything that happens to me now has something to do with cancer, so it doesn't, but so that's all the good news. And I also mentioned I'm recently back from a trip to the Caribbean, a cruise, which I was very happy with. I got to swim with the stingrays and kissed one for good luck down at Cayman Island. I was in Colombia, Cartagena, Colombia, and then into the Panama Canal, the locks. We went into halfway in where Lake Gatun is, and then turned around and came back out of the lock in Panama. Then went to Costa Rica, and then to the Cayman Island, and back to Fort Lauderdale, and flew home to Pennsylvania. So anyway, it's all good news. And so if you have stage 4 metastatic prostate cancer, or someone you love has stage 4 metastatic prostate cancer, I strongly urge you to stay in the game. Do not give up. Just enjoy every day that you have, every breath you take. And I'm enjoying my life. I'm traveling. I'm going to travel again. I'm going down to what they call the Mexican Riviera later this year with my sister, who's my traveling companion, and enjoying it a lot. And peace. I will see you later.